and welcome to Tbilisi International Airport. We've just arrived and we are here to visit Talizi Hair Transplant Clinic. We're going to take you on a journey into hair transplantation at Talizi Clinic from the start to the finish to find out what makes Talizi Clinic the most advanced hair transplant clinic in the world. We arrived yesterday evening to the hotel, which is approximately 25 minutes from the airport. It's a traditional, beautiful Georgian hotel. I've had something to eat yesterday evening, a good night's rest, and this morning, in the next hour, we will be heading to the Talizi Clinic. I was informed yesterday evening that Talizi Clinic have the newest invention in hair transplantation in Europe. Talizi Clinic to date can transplant long hair follicle units, meaning that you don't have to cut your hair or your head does not need to be shaved, and you can see immediate results after your hair transplantation. Here we are now at Talizi Clinic, and we are just moments away from meeting Dr. Akaki and also to discuss my hair transplantation.
Nice to meet you.
Nice to meet you, Dr. Akaki.
How are you?
I'm good. Pleasure to meet you.
Nice to meet you.
Thank you very much. We are here now in Talizi Clinic, and in just a few moments I will start my consultation with Dr. Akaki about my procedure for today.
Please.
Thank you.
That is our patient. We operated him yesterday. We made 2,500 FUE procedure. He was notified, and second day after the surgery, he comes for postoperative consultation. They will check his recipient size, donor size, wash his head, and you can see observe.
So the result is within 24 hours of...
Today it's okay. Let's see what it will be after 1 year when all transplanted follicles will grow. But for today it's okay.
Yes.
He has no pain, he feels very comfortable.
Okay, so he will remain in Tbilisi for today and will travel back to his country tomorrow?
Yes, tomorrow.
Okay. And he may return back to work after?
After a few procedure, he can start workout even from tomorrow.
Okay.
No problem.
As we have just viewed, we viewed a patient from yesterday. On average, there's 2 patients hair transplanted each day at Talizi Clinic, and the minimum waiting time to have a hair transplant at Talizi Clinic is 2 months. Now we're seeing a patient from yesterday's surgery that is being treated by one of Dr. Akaki's surgeons, and his hair is being washed and checked that the follicles are correct regarding the hair transplant procedure. The patient is very happy with the results, and within 2 months to 3 months new hair follicles will start to grow, and the transplanted follicles will start to fall out. We are now here with Dr. Akaki in the interview, and I would like to ask some of the most common questions about hair transplantation. Dr. Akaki, I've researched many hair transplant clinics in Europe. Before contacting your clinic, I've noticed that surgical prices are much higher in Europe than in your clinic. Can you explain why this is?
Answer is very simple, because Georgia, located in Caucasus, it's different region, and prices in different countries are different. Real estate prices are different, salaries different, and of course all this affect the price of surgery. It's normal that the prices in East Europe countries are lower than in West European countries.
Dr. Akaki, could you explain to us please the available hair transplant methods within your clinic? I am aware from yesterday evening that you have the newest hair transplant method now in Europe, which is long hair transplantation.
I use all methods in this field. I use long hair transplant technique, I use FUE technique, I am making follicle unit transplantation, giga-session, we can do body and beard hair transplant. All methods that have their advantages and their disadvantages, their indications and contraindications. But when you have all this method in your arsenal, you can get better result in every individual cases. Long hair transplantation is new technique, it's Brazilian technique. Marcelo Pichon was a pioneer of this method. It's excellent technique, gives immediately results. And when a doctor is using this method, he is working with not only follicles, but with follicles with long hair, and he can, and so patient can preview the final result. That's why this method gives maximum naturalness appearance, and results with this technique is best today.
So what I believe is that the patient will have immediate results after the hair transplantation.
Yes.
And the donor area does not need to be shaved or cut.
Yes,
Is that correct?
of course, you're right. Yeah.
In the situation where I don't have sufficient donor supply, can hair be transplanted from different parts of the body?
Yes, when donor supply isn't sufficient, we usually use body hair. We can use hairs from chest, from pubic area, but today best results gives beard to scalp transplant, because beard hair is thicker, he grows, and his coverage is much better than when we are using hairs from chest or from hand or from legs. Beard hair transplant is very easy to do for patient. Patient feels no pain, no complication. They can shave beard after third day post-op, and also I made beard to scalp transplant.
And is there any scars or from a beard transplant?
No,
it's not noticeable.
You can notice some scars on my face.
No.
I told that I made beard to scalp transplant.
You've had beard?
Yes. I was patient also.
Okay. So you understand also from a surgical point of view, you understand from the patient also. After a patient has had a hair transplant within your clinic, is there required medication for that patient?
For surgery, isn't required any medication, but if patient uses Rogaine or finasteride, of course it improves the results of hair transplant, and of course it's prevent future hair loss. But surgery or hair transplant procedure itself does not require any treatment.
And should a patient that has taken Rogaine, at what stage should they stop before they have the hair transplant procedure, or can
with our technique of anesthesia we have no bleedings. That's why it is not necessary to stop Rogaine for us. It isn't necessary to stop Rogaine before surgery. He can continue it.
Again, Dr. Kaki, after a patient has had a hair transplant, what is the minimum time required before they can return back to work?
If we use FUE technique, patient can work next day. With follicle unit transplantation, heavy work, we permit to do after 2 weeks post-op.
And
office work, it can start even after third day.
After third day, so there's no risk of infection with the wound?
No.
Okay.
Patient wash his head next day, and there is no any risk of infection, donor infection, recipient site infection, suppurations.
Will the patient require additional shampoos or specialized shampoos? Nothing.
Patient doesn't require any special care for transplanted hairs.
Once a patient has returned back to their country, the procedure, depending on the patient, I believe, for the hair growth will start from 3 months onwards. and the hair follicle units will fall out individually, not all at the one time. If a patient requires additional information or has some questions, is there aftercare support in place with your consultants in Europe, or would they contact you directly?
They of course can contact us directly by email or by Skype, or they also can contact our consultants in Europe, and our professional consultants gives any information, any advice to our patient if it is necessary.
So within a time you keep a relationship with your patient?
Of course. Maybe it is difficult to believe, but all our patients become our friends.
Well, thank you, Dr. O'Cahey, for your time.
Thank you. Now let's check here, donor zone, your donor density. These are your follicle units. Mainly you have 3 and 2 hair follicle units. Let's count your density. Just will assign individual follicle units on the screen, and this system will automatically count how many follicle units you have in 1 square centimeter. So you have average density. Your density is 68 follicle units in 1 square centimeter. During this procedure, this session, we will harvest only 1 from every 5 follicle units. So our target will be mainly 3 hair follicle units. It is very main advantage of FUE technique, because when the doctor is doing strip session, he harvests skin and surgical assistant prepares 1 hair, 2 hair, 3 hair and 4 hair follicle units. But while performing FUE procedure, doctor's target is mainly 3 and 4 hair follicle units. So when I will start surgery, I will harvest not this one, I will harvest this one. I will harvest not this one, I will harvest this one. I will prepare, for example, this one. I will prepare this 3 hair follicle and not this.
Yes. So
hair graft ratio of harvested follicle units will be much higher than while strip technique.
So what I understand, Dr. O'Cahey, is you, during consultation within the clinic, you microscope the donor area, which allows you to see and to also choose the follicle units with 3 hairs first, before you will go to 2 hairs and then to 1 hair, resulting in 1,000 hairs transplanted.
Yes.
It can result in 3,000
Yes,
hairs on.
You're right.
Yes.
Close to 3,000. Of course, this system is very important also because patients are different. For example, if you are a doctor, not me, you are Dr. Philip, and you are performing surgery, for example, in such patient, he has excellent donor supply. He also has excellent donor supply. Mainly this patient has 1, 2, 3, 4, 5, 6 hair follicle units, 3 hair follicle. But for example, this patient has mainly 1 and 2 hair follicle units. And of course, his result will be much worse than previous patient's result. Even if you are doing same number of grafts, and even if you are using the same technique, and even the team which is performing the surgery is same. But the previous patients will have much better result than this one. For example, in your case, here graft ratio is approximately 2.3. So on average, your grafts contains, one graft contains 2.3 hairs. So if you transplant 1,000 grafts, it means that you're transplanting 2,300 hairs, 2,300 follicles.
Dr. Kaki, during the hair transplantation, are the hair follicles implanted at a certain degree, angle?
Yes, of course. In front, direction of the hair is 30 degree, and in mid-scalp review up to 45 degree. It's before hair transplant, after 4 or 5 months, and now.
The results are very good. How many grafts, Dr. Kaki?
4,000 FUE grafts. You can see that this FUE session, little dots.
We're now just finished consultation with Dr. Kaki, and we're ready to start the first procedure in hair transplantation. I'm very impressed so far with the hygiene of the clinic and the level of expertise within the staff. So, come on. So the first stage before I will go into theatre is to shave the head and prepare the head. We are now in theatre, and within moments Dr. Kaki will arrive. He is now preparing himself for my hair transplantation. I will now lie down on the surgical table where Dr. Kaki and his medical assistants will numb the donor area to extract the follicle units.
I start administration of local anesthesia. It will be several needles, several mosquitoes. Is it painful?
No, I can just feel a little tick.
Second one. Third.
Now Dr. Kaki's assistant is numbing the area where the hair's follicles will be transplanted. I feel no pain. The first two areas, it feels like, example, you're getting a tooth removed where you're numbing the area. But now there is no pain, and I'm aware that this doctor is actually numbing the complete area to transplant the follicle units. So we are now going to take a short break. The recipient area and the donor area has been numbed, which you have seen, and we will have some tea or some coffee before we will go back into theatre to start the extraction and implantation of the follicle units.
Now we are going to start creation of recipient sites. In this session we will create all recipient sites first. This is new technique. It's great American surgeon Robert Bernstein. This is his method. When we create all recipient sites first and then start extraction of needful amount of follicle units, this combination decreases time out body of grafts and increases their survivability. Now, do you feel any pain now? Do you feel anything?
No, I can't feel anything. Dr. Kaki, how many hairs will be transplanted per centimeter?
It depends of your donor density. In this case, I think density will be approximately 30-35 follicle units per square centimeter.
And I'm hearing an instrument to my right. Can you explain what this instrument is?
This is counter of recipient sites. It automatically counts how many sites I have created.
Now we have only 84 sites.
I'm very surprised actually at the procedure. It's completely painless.
We are using 20 gauge, 90 and 80, 19 and 18 gauge needles for 1 hair, 2 hair and 3 hair follicle units.
And the depth of your implantation is
According to the graft's length, so these needles are bending, and this bending of the needles minimizes the depth of incision up to 4-5 millimeters. It depends on the length of the grafts, which will be implanted in these pre-created holes.
I'm very surprised at the procedure. It is totally painless. And from memory, a couple of minutes ago, I've looked at the counter, and I think we are approx 600 incisions made in my recipient area. During consultation with Dr. Akaki today, we agreed that 1,800 grafts would be suitable for my hair transplant. You can see that Dr. Akaki has in the recipient area for 2,035 given 235 grafts for free. We are now complete with the recipient area, and shortly we will start the extraction from the follicle units for implantation.
I mentioned that my target is mainly 3 hair follicle units, and your hair graft ratio will be more than 2.
Now we're finished the extraction. Dr. Akaki and his assistants has extracted 2,020 grafts. We shall take a short break. I will have some coffee or refreshments, and in the next 30 minutes or so Dr. Akaki will start to implant the grafts. At present they are checking the grafts that the grafts are healthy follicle units. Only healthy follicle units will be implanted. I'm quite surprised with the procedure so far. It's totally painless. We've taken a short break. I've had some refreshments, and we are now at the point of implantation in the recipient area. Dr. Akaki will explain the procedure that his assistants are carrying out at the moment.
This is a final stage of hair transplant procedure, of FUE procedure. Our surgical assistants are placing grafts into pre-created recipient sites. 3 surgical assistants are working simultaneously, and every assistant implants from 10 to 15 grafts in pre-created holes. So totally this team implants 40-45 grafts per minute. So we will finish this stage of hair transplant procedure during 1 hour, 1 hour and a half.
Dr. Akaki has informed me that in the next 10 minutes his surgical assistants will be finished implanting the hair follicles. The next procedure will be to change the bandages preparation until tomorrow. Now my hair transplant is complete. I will be brought to the hotel where a medical assistance is available for all patients 24 hours. And I would like to say thank you, Dr. Akaki, very, very much.
Thank you. Take care.
Here we are now on day 2 of my transplant surgery, which today is a day of rest. Regarding my hair transplant and my first night sleep, I had a little bit of discomfort in the donor supply area. It took me a little while to fall asleep. Today, as you can see, I have no swelling. There is redness where the recipient area. This will last for approximately 10 days, depending on the patient. And I'm happy so far. I'm happy so far with the procedure. I have no complaints, and I've looked at individual processes of my hair transplant. I'm very happy so far. One of the major advantages of Talizi Clinic is price. FUT method is €1.20, which is known as strip method. FUE method is €2.50, which is known as punch method. And Talizi Clinic also have long hair transplant, which is €2.50 per graft, meaning that immediately after your hair transplant, you can see results. In Europe, from my research, for a graft is anywhere between €6.50 and €8. Meaning, the hair transplant which I have had performed at Talizi Clinic has cost me €5,000 plus my air flight ticket. Accommodation is free, full board, collection at airport and departure. The same procedure within Europe can cost you anywhere between €14,000 to €16,000. I would like now to go underneath the light and just to show you underneath the light my hair transplant and explain a little about it. So you can see clearly of the hairline which was agreed between myself and Dr. Akaki that this would be the appropriate hairline for my hair transplant. Later I can lower it if required. You will see that there's redness through the recipient area from the implantation of the hairs. Within 10 days or 10 to 15 days, this redness will disappear. And within 3 months, new hair growth will start to grow, meaning that between now and the 3 months, these implanted hairs will fall out individually, not at the same time, but individually, and new hairs will start to grow. Now we will go to the clinic where I'll meet Dr. Akaki and his assistants, and the bandages will be removed and my recipient area will be washed, and the rest of the day will be a day of rest where I will be brought on tour around Tbilisi to view historic sites and to see the beauty of Tbilisi. So we're now removing the bandages, and we will wash, what I understand, the donor area. Now we're at the stage where Dr. Akaki's assistant is washing the donor area where the hairs have been extracted, and also the recipient area. For the next 10 days, it's very important that I will use baby oil shampoo. Johnson & Johnson's is a well-known brand in Europe, and I must wash completely the recipient area and the donor area, gently just patting it as I am washing it, very, very gently, each day for the next 10 days. So we're here in the clinic, and we have a patient from the USA, Mr. Keith Moeller. I've asked for permission from Dr. Akaki to use his office, and we'll just have a brief conversation about Keith's procedure, which Dr. Akaki will be carrying out today in the clinic. Keith, you have travelled from the USA to have your hair transplant with Talizi.
Yes, that's correct.
And you've had consultation online, or have you met in person?
I met Dr. Akaki in person.
So you visited Tbilisi, you were here on vacation?
Yes, I was here with my wife, who's from Tbilisi.
Tbilisi, good. So your procedure today is FUT method, what I believe. So FUT method, as known as strip method. How many grafts today will Dr. Akaki be implanting?
Well, we're going to be doing 1,500 grafts.
1,500 grafts, which will consist of 4 to 5 hours surgery, yes?
I think a bit less than that. My understanding is it's going to be about 2 hours.
About 2 hours, okay. It depends on the medical assistance that he has. So he has 3 surgeries today. What pushed you towards Talizi? What was the main reason to decide to have your hair transplant with Talizi Clinic?
I saw the website, was pretty impressed with how professional that looked to me. The cost is obviously a big consideration for me. It's about a third the price for me to do it here. And after doing some research, I found some good reviews. So altogether, I felt pretty comfortable with this clinic and that it was professional. And Dr. Akaki has a long background in doing this type of procedure. And of course, the price was a great thing. So I was here in Tbilisi already with my wife, and I thought, why not do it while I'm here?
Keith, thank you very much.
You're welcome.
So now we're at the final stage of my hair transplantation. My donor area, as you've seen, has been washed and cleansed. I feel a slight numbness in the donor area from the anaesthetic still from yesterday, but Dr. Akaki has advised me that it will, in the next 24 hours, become less, and within a couple of days I should have complete feeling back in my donor area. So let's have a look at my donor area that now is after being washed, and we will see where there is small little holes, and this will close within time. This will close. So altogether, the experience, it has been an experience. I have tried to, you as the viewer, to show you each step of the procedure. I've examined issues off camera also. So